Hello, today we're going to do a renal presentation about gout. Gout is caused by excessive buildup of uric acid in the body, overproduction of uric acid, and then kidney unable to eliminate. So risk factors include diet, weight, medical condition, medication, family history, and recent surgery or trauma. So increase in weight can cause higher production, and then medical conditions such as hypertension, diabetes can cause it, and then medications such as medication for hypertension and an ACE inhibitor and beta blocker can cause increased uric acid.
So the pathology, it's mostly going to present itself as like redness and swelling in the joints, specifically the hands and feet, but it really can be anywhere, but that's where it's most common. The joint pain usually is worse at night. It doesn't occur too often, but as things get worse, it becomes more frequent and it lasts longer every time. It will be warm, red, tender, and then you'll have impaired mobility because of the literal growths that are there, deformed areas, and then there'll be tophi, which are firm yellowish white nodules that are specifically found on the fingers. And then relevant labs, there will be synovial fluid analysis and serum urate level to check the uric acid levels and the urate levels too.
So these are some of the diagnostic tests we do for gout. We'll go into greater detail later about those. The epidemiology is patients with frequent unexplained joint pain. This is the most common cause of it. It often occurs at night and is very brief, from like 1 to 3 hours, but it can get longer and more frequent, lasting up to almost 3 weeks. And it mainly affects the joints, and it affects about 3.9% of the American population. Prognosis is if it's diagnosed early enough, lifelong treatment will allow patients to have a normal life. Morbidity is increased in people with metabolic syndrome and cardiovascular diseases because of the excess urate levels. And if it's diagnosed before the age of 30, it's generally more severe.
So these are the diagnostic tests. So the labs, you're gonna draw urine, and they're gonna check for the uric acid presence in it. And then you can also x-ray the joint that's infected and then also do an ultrasound. Gout cannot be diagnosed unless there's a flare-up of when the joint is swollen, painful, and hot.
Some treatments are medications to help treat the symptoms of gout, which would be NSAIDs, colchicines, and corticosteroids, and those help with inflammation and pain. For preventing gout, there is allopurinol and febuxostat, which are used to block the uric acid production. And then you could also use probenecid, which improves the kidney's ability to remove uric acid. Some procedures that could be done are tophi removal, which is done when the tophi get infected or there's swollen growths. There's joint fusion, which is the fusion of bones in a joint together to help relieve pain. And joint replacement, the damaged joint is removed and then replaced with an artificial joint. And then these surgeries are only done when the chronic pain does not go away with the treatments. Diet would be to avoid foods in high purine like red meat, liver, anchovies, sardines, tuna, scallops, mussels. A good source of protein would be low-fat dairy, and then you want to avoid alcohol and sugary drinks. Some lifestyle changes would be to maintain healthy weight and stay active with low-impact workouts like swimming or walking.
Alright, so nursing care, we're going to want to manage pain. So we're going to manage pain with medications that Emily said in the previous slide. And then you can also do apply cool cloths as tolerable or like an ice pack to help with swelling, and it kind of numbs the area. Also assisting with repositioning to avoid pressure on the affected joint. And then we're going to assist with mobility, but also encourage, if they're not inpatient, to do exercises. One thing I read is swimming's really good for the joints, so get them out there. Promoting hydration increase the fluid intake. So your kidneys have to excrete more, and it gets rid of the uric acid.
Hello.
Hi, my name is Sydney. I'm a nurse.
Hi, my name's Emma, and I'm a doctor.
Hello.
Can you tell us what's going on with you today? Do you have any pain?
I have a lot of pain. It's burning, and it tends to happen when I'm asleep or at night.
Okay, is it only in the joints?
Yeah, it's like in my fingers and my toes.
Swelling?
Yeah.
Is it hard to like move?
Yeah, can really squeeze my hands.
Okay.
Okay, I'm gonna take an X-ray real quick.
Okay.
Now I'm gonna go read the results. Your results have came back that you have gout. Do you know what gout is?
No.
Okay, so gout is a buildup of uric acid in your joints, so they come super stiff. But the good thing is it's very treatable. So I'm gonna call pharmacy, and they're gonna come down here and explain medication.
Hi, I'm Emily. I'm the pharmacist. So today I'm just going to give you some NSAIDs that are going to help with the inflammation and pain, and then we're going to give you allopurinol, and that helps to block uric acid production, and the probenecid, which helps remove the uric acid from the body.
Am I gonna
Okay.
be peeing a lot?
Yes.
Okay.
All right.